Yeah, hi, this is Dr. Jaitly. In this video section, I'll be talking to you about briefly what is broken heart syndrome. It is a condition that is precipitated by an emotional stress, usually in the form of a fright, anger, or an extreme surprise, or demise in the family, or divorce, or a boyfriend-girlfriend breakup, etc. So the individual normally gives us emotional precipitating history, which precedes the onset of the symptoms. What are the symptoms? The symptoms are exactly like a heart failure. That means abrupt onset of shortness of breath, or they could be mimicking a heart attack, like they're having an acute chest pain, typically, where a person may be sweating, the pain may radiate down the arm, etc., etc. Now, interestingly enough, the heart starts to show some bulges if one was to do an echo on them, and the wall will actually bulge outwards in these individuals. Now, the coronaries in these patients tend to be non-obstructive. That means there is no obstruction. If somebody was to do an angiogram on them, their coronaries will be not obstructed. So what have we learned so far? A broken heart syndrome is usually precipitated by an emotional stress, like that of what I said, a fright, anger, or a sudden demise, or a breakup in the family, or friendships, and presenting as acute chest pain or shortness of breath, like a heart attack or a heart failure, invariably requires immediate help. So the person should seek immediate help, and the family should bring the person to the emergency room for acute evaluation. The good news is the coronaries are not obstructed, in contrast to the heart attack victims who have obstruction of one or two vessels that precipitate the heart attack. So it is an important condition to be recognized, should be treated or should be recognized and treated immediately at the emergency room or in the hospital. But the good news is only supportive care is required, and it improves the condition with full recovery in a few days to weeks. In other words, the heart muscle will return back to normal total function in a matter of few weeks. So that's the good news. So, but it has to be recognized, and of course you have to treat any chest pain and shortness of breath very seriously and report to the emergency room rather quick. Okay. Thank you for your attention, and looking forward to seeing you in my next. Bye.